are in our fourth week, so now we are at male sexual anatomy and physiology. We'll start today by lecture, so giving some background on male sexual anatomy, looking at the penis and reproductive system. After that, we'll look at a video about an issue with male sexuality and anatomy. And beyond that, we'll have some discussion questions. I like to get a little swig of vodka before we get this class started. Just getting some more vodka. All right, male sexual anatomy. How many individuals identify as men in this classroom? I hear a show of hands. 1, 2, 3, 4. I want to know that's important because when I break up in groups, I want to have at least one man each. Right? Moving along. Okay, so we have the penis. Right? The penis throughout history has been sort of placed on the pedestal due to men having the position of power in most of the empires, the kingdoms, right, territories. And so a lot of the penis has sort of synonyms attributed to various parts, which seem to be a little bit biased, right? Those things, power, and things like that. And we'll learn about that. So here's some external anatomy terms we want to know. Foreskin. Right? We want to know what foreskin is, glands, shaft, and a root. Some of our internal anatomy of the penis, right? We look at the cavernous body, so the corpora cavernosa, spongy body, corpora spongiosum, and penile urethra. Right? We always think of things like spongiosum. We relate that also to women too. It's usually where the blood sort of enthralls or engorge in the area, right? To make it expand. All right, so here's a diagram of a penis, right? We're looking at it from a lateral position. So here we have our shaft, right? The shaft is usually anything below this glans. The glans should be described as the head. The glans is essentially the head of the penis, and the shaft is the body of the penis. Now the root is where you start to get closer to the testes and testicles. So these are segmented into 3 different areas. So we have our glands, our shaft, and our root. So where does the sperm, as well as the urine pass through? It's this right here, your urethral opening. Okay? So we saw with females that it's a little bit different when it comes to sex. There's 2 separate sort of openings. One used for urinary tract, right? And the other one used for a vaginal opening. Here we see with the man, there's just one. All right, and so we have our spongy body. Right? Our spongy body is used to engorge with blood so that the penis is able to expand. So a penis can either be flaccid, in which case there is no blood to expand the penis, right? Or the penis can be erect, in which there is blood engorging the spongy body of the penis. Right, and looking at the top of the penis here, we have the outer skin, right? Looking at the underside of the penis, which is spongy body. So you say here is spongy body, and also this one is spongy body too, even though it's cavernous. So with this cavernous body, we have blood coming through and expanding out into the glands here to engorge. Right? So we have 3 different sections of which there's engorgement. And for the men, you probably notice that if you touch the underside of your penis, there appears to be 2 sort of spongy things that you feel when erect is hard, right? And in the center of that, you can also feel a harder substance, and that's the spongy body. Here, penile. All right, so the penis has areas particularly responsive to stimulation. So we say the head of the penis, or which they call the crown, right? The crown or corona. Corona means crown, right? Is the rim of the penile glands, which means it's the underside of the penis. So here's our penis, and we're looking at the underside of the penile glands, the underside of the head of the penis. Here we're filled with a ton of sensitive nerve endings, little nodes or nodules, right? So if a man was to touch this area, he would probably feel ridges or bumps of some sort, right? Very densely compacted. Here is where the man has the most sensitivity in terms of stimulation, right? And when it comes to the shaft, the body of the penis, not so much, right? There's not so much sensitivity here. So a man essentially can become very aroused to the point of ejaculation simply by touching of this area on the penis. All right, and we see what's being pulled back here. We're being pulled back the foreskin, right? So a man is born with foreskin. We would call that uncircumcised, right? And either his parents or himself or someone else can choose to remove that foreskin for various host of reasons. Some of it could be religious reasons, right? Some practices say to remove it on the 8th day. Modern medical practices usually they remove the foreskin on the first day that the child is born. And some choose not to, right? For various reasons, biological or some ideological reasons, but we'll get to that in a second. Underneath that, we have here what we call a frenulum. A frenulum is essentially cornered beneath the corona in the body of the foreskin, and it sort of acts like as an elastic rubber band, kind of pulls things back, right, and also keeps it intact. So it provides strength to keep the foreskin intact, so that it's not pulled back excessively. You have multiple frenulums in your body. Who can think of a frenulum? Where do you have something like this little elastic area in the body? Where else you think? What about your mouth? Who can think about their mouth? The bottom of your tongue, right? So open your tongue for the bottom of the tongue. There's another frenulum. The top of your mouth. Pull up the top portion of your lip. You have another frenulum like this, right? So you got several frenulums, and they serve the purpose to essentially keep intact your lip from dropping. Okay. Beyond that, we have our urethral opening. So we say sperm and urine comes out of your urethral opening. Now back to the corona, right? You would say, well, circumcised versus uncircumcised. What are some of your opinions or arguments? Is it better? Let me ask the men. Theoretically, not your experience. Right? You don't have to give experience. Do you think it would be better for a man sexually to have a circumcised penis or an uncircumcised penis? Women included, you could join in. What do you think?
There's naturally less friction because there's more loose skin. So I think that's probably the evolutionary reason we have one. Maybe it protects it a little bit. But it seems like it's there for a reason. So it's like, why mess with nature and cut it off? But like, it doesn't seem like there's a part of it.
Yeah. But ultimately, you think it gives more pleasure?
If done correctly, it seems like it would avoid the nerve ending spots.
Okay.
You're technically putting just the skin not into the corona.
Yeah. All right, so you're saying it's better to leave it because you're protecting the sensitive area of the corona with all these nerve endings. Anyone else has a theory on it? What do you think?
Can you I've never really understood like circumcision. Could you like explain like where exactly, where exactly it was?
Is the cut going to happen?
Yeah.
Yeah, so they do two different. One is by blade and one is through cauterization, which is a burn, right? Yeah. In essence, you're, you only seeing here in this diagram sort of the underside, right? There's an overside on the opposite. So essentially, you are taking back all of this skin, cauterizing it, cutting it, right? You're removing maybe all of this, and then you're stitching it back together.
Okay, so
To expose the corona of the bone.
so all that force is essentially just cover that already. So then I guess we're needing a way to more coverage, since there's more access or better access.
It also naturally rolls back though.
It does.
Did you know that? It's like a hood that you can take down.
Yeah, right. So one argument could be like, hey, you know what? That back and forth movement through penetration. You say, hey, if I'm having sexual penetration, this back and forth movement of the skin on top of the corona might be very, very pleasurable, right? It could be maybe self-pleasure. You're like, well, really, maybe I'm getting most of the pleasure from the foreskin myself, right? Now, if you remove it, the argument could be, well, there's more pleasure because now you just expose this. Maybe this gets stagnant and don't move as much, penetration, or even masturbation for that matter. And now you've exposed it, you got 100% opportunity to cause traction, abrasion of the insult, right? To give sexual. Alright, several different health reasons, right? Concerns, pros and cons. All pros and cons, right? On average, those who are uncircumcised have a higher likelihood of transmitting STIs because, so we say, you know what, if not properly cared for and taken care of, you say, well, during sex, you could be getting fluids from your partner, right? All sorts of other things, maybe even from your underwear. Don't wear underwear, maybe from your pants, you can be getting all sorts of particles throughout the day or through sexual activity. And if you don't properly clean this, in whatever time frame or consistently throughout the day, however you want to go about it, yes, you have a ton of buildup that can happen. A few things, one, they can smell, like they call smegma, can build up, kind of a yellowish sort of accumulation of all sorts of things, right? It could be fluids from yourself, fluids from others, built up. The other part, too, is that you may feel less sensitive, right? Because you're like, depending on how it's cut, where it's cut, right? You can experience something traumatic there in which you feel more area to where it got cut than here, right? So the mind tricks itself into feeling some sort of damage here as opposed to here. We'll look at an example of that in a YouTube video about the boy with no legs. We'll look at that. Who else could think of some pros and cons for foreskin or no foreskin? Any other pros and cons you could think of? Having one or the other? All right, we'll come back and see what else. All right, so the corona is that rim of the penile glands. The frenulum is the highly sensitive thin strip of skin that connects that glands to the shaft, right? So that area is highly sensitive as well too. So another theory is that if you do have an uncircumcised penis, that frenulum is still going back and forth. And if that frenulum is going back and forth, highly sensitive, but there's even more pleasure, more sensation, more stimulation through intervals. Right? Now, how can you go about strengthening your musculature around the penis? Same with women. We say you use Kegel exercises and produce benefits, right? in essence, that can help men have longer erections, right? To help with erectile dysfunction, things of that nature. All right, next we're looking at the scrotum and the testes. Let's see if we got our diagram here. All right, here we'll start with the testes. All right, so we said the scrotum and the testes, we have a pouch of skin of external male genitals that encloses the testes. Okay? The testes are your male gonads that produce sperm and sex hormones. Right? So this testes creates the sperm and it also creates the hormones for sex. It usually arouses men, it stimulates them, and also suppresses them as well too. So here we're looking at our testes, and inside what we call the testicles. Right? And our testes look similar to maybe ovaries, right? In some similar way. Testes will produce sperm. Sperm will come out through the penis, through a whole range of sort of tubes. One here is the vas deferens. And if you were to get a procedure in which you did not want to have children anymore, called a vasectomy, in essence, you would be cutting off the vas deferens. So that sperm, you will still have an ejaculation, right? Because ejaculation doesn't encompass just sperm. It encompasses a bunch of other range of fluids. But if you were to cut off the vas deferens, you would be cutting off the sperm supply. If you ever got a vasectomy, this is what it would be. All right, cryptorchidism, right? Undescended testes. You may have heard, maybe older men, or women in the class, you may have heard it say, hell, your testes drops, right? We usually say your balls drop at some point in life, right? But here we're saying here you may have undescended testes. So it's important that the testes do descend in some way because it makes for a healthy sort of pathway for your sperm to come out, right? Come out of the testes through the vas deferens and through the spermatic cord. All right, then we got our seminiferous tubules, these thin coil structures in the testes in which sperm are produced. All right, let's take a look at that. Then we get epididymis with the structure along the back of each testes in which sperm maturation occurs. So this is where your sperm actually matures in order to be live and then go up to an egg in order to produce an offspring. So see that this is located at the back of the testes. Right? So your sperm will sort of mature, incubate here, resting, so that it can become live sperm. All right, and we say that vas deferens, right? You carrying tube that begins at the testes and ends at the urethra. Sperm held in epididymis eventually drained into the vas testes. So for those who want to become sterile, you can essentially remove a section from each of your vas deferens. All right, now here's another cross section. We'll end up here before we look at a video. Actually, let's look at our video. Look at the boy with no penis. I'll tell you the story.
Bruce Reimer was a boy born in Winnipeg, Canada, alongside his twin brother Brian on August 22, 1965. As the twins started growing, they showed some problems urinating due to phimosis, a condition in which foreskin cannot be pulled back off the head of the penis. When the boys were 7 months old, their parents Janet and Ronald Reimer took them to get circumcised in order to fix the problem. What the parents didn't know was that the doctor in charge of the circumcision was using a method of cauterization, a burning technique, instead of a traditional blade. During the procedure, Bruce Reimer suffered a horrible accident which resulted in his penis being burnt off. His parents were devastated by this, and after hearing of their son's accident, they decided against having his brother Brian circumcised, whose phimosis later cleared on its own. While questioning whether or not their son would be happy as a male with no penis, their mother happened to be watching a show on television that featured a psychologist named Dr. John Money, who specialized in biology of gender and sexual identity. He appeared charismatic, intelligent, and confident, and he was also well respected and reputable in his field by his peers. He had a theory that gender was not something you were born into, but something learned through socialization and upbringing. The parents felt this was the answer to their son's problem, so they contacted Dr. Money and told him of their situation. Dr. Money invited them to Johns Hopkins Hospital in Baltimore to meet with him. After discussing the matter, the doctor convinced the parents that it would be in their son's best interest to raise him as a girl. So it began, that while his brother Brian was raised like a boy, Bruce was raised as a girl and was given the new name Brenda. At 22 months old, his testicles were removed, he was given dolls and other girlish toys to play with, pretty dresses to wear, and as instructed, they did not tell Brenda about his accident. He and his brother would both go to yearly appointments to see Dr. Money so he could keep watch on Brenda's progress. It's worth mentioning that the twins were a perfect experiment for him to test his nurtured not natured theory, given the circumstance that there were 2 of them from the same genes for him to compare to each other. However, some issues arose. His parents and the doctor could see that he was showing more masculinity than he was feminine qualities. His brother Brian would share his toys with Brenda because Brenda was happier playing with things boys played with, and playing games that boys normally played. Brenda showed no sign of feeling like a female. If Brenda didn't fully accept being female as his identity, it would disprove Dr. Money's theory and his book about gender being a result of social construction. At 7 years old, the boys started to be subjected to more sexualized experiments, like being asked what the differences are between boys and girls, and taught the sexual roles played by men and women. The doctor would make them role play the positions themselves, like Brian standing behind Brenda and leaning his crotch against his brother's behind. He would also force the boys to inspect each other's genitals. On one occasion, he had the children undress and took nude photographs of them. If the children did not do as asked, the doctor would yell at them, to the point where they thought they would be struck. The children did not like the sessions with the doctor, but they didn't tell their parents what was going on. It was also around this age, Dr. Money tried talking Brenda into going through an operation that would completely change his parts to what he told Brenda they were supposed to look like a girl. Brenda was very scared of the thought and refused. Later on, when Brenda was becoming a teenager, the doctor made one last attempt to convince him about the operation. He invited another patient of his, a transgender female who had undergone an operation willingly, to talk with Brenda. It was after this that Brenda told his parents that he would kill himself if he had to see the doctor again. It was at this time the parents felt it was best to tell their sons the truth. Ron took Brenda out for ice cream, while Janet took Brian elsewhere so they could individually tell their sons the truth, that Brenda was actually born a boy. Brenda, after being told that he was actually born a male, felt immense relief. He felt like himself and he was happy. His brother, however, could not handle the situation and took great shock to the news that his sister was actually his brother. The events surrounding Brenda caused a mental disturbance in Brian Reimer that would eventually lead to schizophrenia and his detachment from his brother. Brenda was ready to take on his new life and renamed himself David. Before, he was excluded by the kids in school for his differences, teased and tormented, and felt different from everyone. Now he started making friends, had positive thoughts about the future, and embraced his identity as a boy. He started taking testosterone supplements to counteract the effects of estrogen hormones that the doctor had given to him over the years. This led to him getting a double mastectomy to remove his hormone-induced female breasts and 2 phalloplasty operations to recreate his penis. He also received a sum of money for the botched circumcision. Eventually, David met a woman named Jane Fontaine who had 3 children. They fell in love, got married, and David was happy with his new life. Things seemed to be looking up for him. However, things changed when David heard that Dr. Money was informing people that his experiment with David wanting to be a girl was a success, and nothing could be further from the truth. This caused David to get a hold of his brother so they could speak out against the doctor in the hopes of keeping other children from having to go through what he did. Brian agreed, and they opened up to the world about the truth of their history with Dr. Money. Later, in 2002, Brian Reimer was found dead after overdosing on antidepressants. Aside from David having to deal with his brother's death, he was conned out of $65,000 in a bad deal and was having trouble finding work. He was also having problems with his marriage, in which his wife asked for separation time. On May 2nd, 2004, David sawed off the end of a shotgun and drove to a nearby grocery store where he shot himself in the head. He was 38 years old when he took his life.
Alright. Long story. Interesting. What do we get from that? Well, first, this all occurred from what? A botched circumcision. So we just showed how circumcisions can go completely wrong.
He said, no, I'm serious. I've seen that look in people's eye when they want to kill somebody.
There's my
She
first
wants to
question.
be killed.
Parents getting their children circumcised involuntarily as babies. Do you find it to be genital mutilation? Or you think that should be left up to them? No. Take a couple minutes. Think about it for yourself. Should circumcision be left up to the parent at birth? Or should we consider it genital mutilation as we would with female, that she has something of her reproductive system?
Could you get circumcised in your own life, or would it have to be done while
You
you're
get circumcised at any point in time, yeah, as an adult. Sometimes you do run the risk later in life of that skin already being tight, right? It's already being formed. So if it's not properly done, it could be uncomfortable because now you have the sex and every time you go back and forth, it feels extra tight, right? So you do need some a medical physician or surgeon who's done many circumcisions. And then also too, you have to think aesthetically. Aesthetically, if it's not cut right, it could be extra foreskin left. So now you have something to where if your penis is flaccid, it almost looks like a double layer or something, right? But the hair is sticking out. Bless you. So you do have the aesthetic sort of things that can go wrong with a botched circumcision. No, it was just something I thought about the other day about. All right, what do you think? What's your thoughts? Let me hear your thoughts on this. What's your rationale? Should parents be left to circumcise children, or should we view it as genital mutilation?
You can look at it as both. I mean, it is, you are cutting, the genital, so it is genital mutilation, but it's still, I mean, I think it should still be left up to the parents, cause like, you run the risk of, like you say, it becoming tighter, the child, or the boy is old enough to like decide if he wants to be circumcised or not, and if it's from, if the parent thinks that there's more pros to it, then, I mean, I would say.
How would you feel the same if it was a practice of,
What would they do to it? Yeah. What would they do to it?
usually they cut off like parts of the clitoris as well too, to de-stimulate them so that they don't have the type of pleasure and see that that's like a sexual arousal.
That's different, because you still have sexual arousal when circumcising. So I can see what the similarities between that, because there's two, they're doing it for two different reasons.
Two different reasons.
Yeah.
Anyone else? What do you think? Who here would circumcise your kid at birth? Let me hear your reasons. What do you think? It could be religious reasons. You say, hey, you know, from a religious viewpoint, this is just what we do, or some other ideology.
So going off of, what was your name? Eve. Going off of what you were saying, it is, the male circumcision is a bit more utilitarian than just the aesthetics of, say, vaginal, where you cut off the labia minora or whatever, and I was like, okay, that's an aesthetic. Medical procedure. But then you look at parents, and parents are in charge of the health of their child, so if there's a medical reason, like they were saying, whatever with the boys of like, hey, this is a problem, you could do this because it would possibly help, so it's up to the parents to decide, do we do a medical procedure or not on our child? Kind of the same as getting your child vaccinated. But then also, there's a line that you kind of draw, so for the right reasons do it, but in my mind it's the same thing as like, I'm not gonna get my kid a tattoo at whatever age, because it's like, that's not my choice to make the aesthetic choice for my child, let them grow up and do themselves.
True. Right?
So for the health of the child, yes.
For the health of a child, yes, you said in the future, but child may come back later and be like, did you cut part of my?
Yeah.
You know, like that,
And
right?
like that's,
Or maybe I don't, you know.
like the thing my parents said is they were like, I remember when I learned about it, I was like, oh, how come you made that decision? And they're like, well, we were in the hospital and the doctor told us like this, this, and this,
Yeah.
and they said it was more hygienic, so we were like, okay.
It's usually
Yeah.
I would want to know more about the preventative measures or any other alternate health things that can be done to prevent these types of infections and bacteria that can happen. Because, so why is it that the foreskin is so prone to infection? Are people told how to properly clean it? Is that something that is talked about? And if it is a bacterial infection, then instead of just cutting off the foreskin, surely there's something that has to do with antibiotics or something else, because just, you know, permanent disfiguration seems
Yeah.
more like a last ditch effort rather than all of the other medical advancements that we have now.
So you're saying it's almost jumping the gun to just
Yeah.
do the circumcision
I
because
don't know if they're all
proper
alternatives,
education and, you know, things we don't talk about, pulling the foreskin back, cleaning it, right? So that things don't get in there, bacteria, viral infections can also, herpes can incubate, right? Which there's a higher likelihood to men who are uncircumcised to spread herpes. Go ahead.
So going off of that, yeah. But you said like antibiotic and stuff, but it's an external part of the body. So it's like, imagine like your teeth. There's a lot of nooks and crevices and a ton of bacteria and stuff that grows in there. And it's about teaching people proper hygiene. But think about all the people who don't have proper hygiene for their teeth. So you're like, I mean, yeah, then it comes down to every single person, but also keep in mind.
And the bacterial infection comes from, I mean, using that example of the teeth, the bacteria is on the teeth, but where it actually becomes a problem is when it gets inside of your body, which is when you would use antibiotics. Same thing with an infection on a penis.
Yeah. All right, interesting. All right, so here, let's, first discussion question, we'll get into groups. Is gender, as we just saw in this story, there's an argument to be made, right? And I want to hear your argument, your theory. Is gender nature or nurture? Right? Because the doctor here essentially didn't give this young man proper information, and the parents sort of acclimated to the doctor's wishes and rearing their child a certain way that was opposite of his biology, right? His original biology, and it led to a host of problems, right? So I would like for you to discuss in group, what do you think? We all may differ on different perspectives of it, but let's see if we can have a good scholarly academic discussion. Is gender nature? What are your thoughts? Go ahead.
Not sex, right? Just-
Not sex.
Okay.
We're saying
Sex
gender.
is
Yes, sex is undeniable. So group 1 is here, group 2 back there, group 3 the same, group 4, was it you 3? Group 4 and then group 5. Right? Remember, this is supposed to be academic. We're not supposed to get too overwhelmed emotionally if people have difference of opinions. We want to have constructive conversations and give rationale and reasons. So let's have it.
Yeah. But because you are born in a certain way, so
There's a certain
stuff, right? You want to do this.
because there's always like, okay, here's my blueprint, and also your reality, one way or whatever, but you start from the start. So I see that as majority, like nature nurture, definitely nature is born
Role models.
and that sort of thing, and then they try to push them one way, and it isn't enough to offset it or whatever, but maybe there's people who are like, environmental, like, guiding me through the whole, or the LGBTQ, now it's just like, let me just define myself as that. Yeah. I've heard this great analogy of like the spectrum isn't like one way, this is masculine, this is feminine. It's like, no, there's two. There's how masculine you are and how feminine you are. So yeah, so I guess it's
Except for a few key parts, like spatial orientation problems, what are the alternatives? I feel as though a lot of parts have to do with just biological nature. For example of that is gender which comes with that whole we're talking about that natural uncomfortability that a lot of people have in saying and like looking at their bodies and saying this is or this is not the right body. I don't want to. Yeah, like this is gonna be a really bad example, but I don't mean it in a negative way. But in the same way that people have distorted views into things like schizophrenia, not saying there's no schizophrenia, because it's an entirely different thing. But in the same way in which that condition totally changes your view on reality and yourself, in a very similar way gender dysphoria does that to people. And so then what makes those things different is that the cure for something like gender dysphoria usually what they've been saying is that gender reaffirmment surgery, whatever they call it, or reaffirmment. That's kind of like what they consider, the cure to combat something that we don't really understand, like the concept of gender and how much
but it's meant, of course we study this. We have to know.
Yeah, a lot of people.
Someone decided to take time and effort.
All right. Let's see what we get. Um,
How up to date is
Is this in the seventies?
yeah, since then.
Freaking European.
European ass unit.
I didn't realize 16.
We'll discuss this. Well, all right, group one, what were some of your thoughts?
On our discussion question?
Yeah.
Let's see, let's do the percentages. We all basically agreed that we think that nature is the primary factor in gender because it's your self-image, your self-reference. So that's your very strong starting point. And there's a little bit of environmental factors that, could be one way or the other. It's mostly nature, and then it's anything else? Or that part of the conversation?
No one disagreed?
Yeah, mostly we said it's nature, and then it's how you then represent yourself.
So nature and self-image.
Yeah.
So nature is just a reference to how one should image themselves, how they should behave within the context of a social group or society.
I think that's kind of the thing I see as like the environmental factor is there's me and who I am, just who I understand myself as, and the environmental factor is the options thrown at you from the environment saying, well, you're this, or you're this, or you're this, and you pick one kind of thing. Yeah, a lot of us pick standard male or female, or however we spread it, but.
All right, so are you still saying that there's a choice in that you pick?
Yeah, I think in the societal sense, you pick what your label for yourself is going to be.
But the inclination is derived from nature
Yes.
on probably your choice, you think? Your nature influenced what you pick?
Sort of. Again, in my point of view, it's just I am who I am, and whether I want to call myself male, call myself female, it's like I remove
Part
the
of what you
labels.
are social influence? Like is part of who you are or identify as a you and how you go about living
Oh,
life?
okay, true. So there's the environment influence how I see myself.
Yeah.
Yes, to a slight degree, I think that most people though have a very strong natural inclination as to what they are.
Gotcha.
I guess that's the better way to say it.
All right, so the nature is the driver and the nurture may facilitate some of it.
A little choice.
Cool. Group two. What are some of your thoughts?
We said that I feel like in the past it would be more so nature, but now that people are more open to like talking about gender and like how they see themselves and for themselves, it would be like nurture. So we said basically a little bit of both.
A little bit of both. Which one do you think is more influential in like a final decision to how you navigate who you are and how you Right? Does the environment causes the influence for one to make a decision about how one feels or should feel?
I feel like it depends on the person and like how they see it. I kind of feel like I would say I would be more towards nature, but I feel like depending on like who you are as a person, like outside experiences and your environment can change like how you feel about it. If that makes sense.
Okay. A little bit of 50-50 split. All right. What did you guys discuss?
So, like other people, we mostly said that it was nature, in that people are born with certain temperaments and inclinations towards things, and then where the nurture aspect of it just really has to do with how long or to what degree that you are allowing yourself to express and be that way. Because I know at least with the people that I've talked to, people who are transgenders, if we're talking about gender identity, is that it's one of those things that they've known for a really long time. Like they had no words to express it when they were young, but they always knew that they were different somehow. And it just, they were never able to actually say, I'm a transgender person, until they had fully developed that idea and were in a place where they could say that and explore, just exactly what that means.
Okay, so you're saying the environment can actually suppress real feelings about how you feel internally,
Because of pressures.
right? Because of the social pressures out there, and there are probably many people who may feel opposite with those external forces. All right, interesting. Okay. Art, what did your group?
We talked about how it's a bit of both, because yes, you are born with a certain mindset, and it's really your environment that helps shape you into the mindset that you grow to become.
Mhm.
So like we talked about how like in the video the boy wanted to do boy things, he wanted to do boy things, he just wanted to be a boy.
Mhm.
And then I brought in the whole idea of how if the father, like if the father is not present in the household, the boy goes astray. In the same way as nurture and
Okay, so you say, hey, you know what? He had an inclination to want to do boy things, although the parents were trying to kind of push him to do the opposite to create this identity for him. So the nurture, in essence, was doing the opposite of what the nature naturally inclined him to want to do, right? What was more powerful there, the nature, in your opinion? Okay, interesting. Group. Next group.
So we kind of like spoke somewhat similarly about like nature and nurture. I kind of brought up the idea of like since the boy was essentially in a controlled environment where they were raised to think this specific thing, but their nature kept fighting that specific thing because they knew like deep down that it's not something that they were passionate about. They eventually overcame it, and when they found the truth, they kind of turned around and full throttle toward their like nature. So in a sense, I feel like it can be a thing of if you're in a controlled nurture environment, then you will oftentimes feel like your nature is kind of like what Mark is saying, suppressed in a sense. Where it's like you don't feel like you're being your true authentic self. So we kind of also brought up the idea of like what if the boy was raised like a boy, like what if he didn't change anything, he just had this accident, and then when he became of age or if they got enough money, they could, start kind of healing from that accident and things like that. Like what would have been done differently if they just kind of let his nature stay his nature instead of trying to control the narrative.
So you're saying the limitation in the environment can cause one to have sort of expressions that mold and fit to whatever the limitations are, right? In that controlled environment. That controlled environment will essentially be the major influence on that person, even though they may feel internally something completely different. Interesting, right? If we're thinking masculinity versus femininity, we're not all the same, right? For females and males, right? Some females may be extremely feminine, some may be more masculine, some men may be, masculine more than feminine, some men may be feminine to that degree, right? And then that turn can lead itself to expressions of maybe something that is different than what the social force has defined as the roles that people should play, right? So clear and undefined, and obviously a big topic of debate. All right, let's hear. We have another. What was I going to talk about? Right. So the myth of penis size. There's some charts as well too. But I just put this up here as a representation about the myth of penis size. There's a myth about racial identities having larger penis sizes than others. Height being an indicator to penis size. Shoe size being an indicator to penis size. In essence, penis size is attributed to its own sort of genetic markers. Nothing correlated or having a relationship with an ethnic background or shoe size, or whether you're tall or short, or any of the sort, right? Penis sizes vary. they vary across the world. This here is in centimeters, which, you know, kind of doesn't do us much justice, but we say maybe on average, across the world, the average, I know in the United States, is probably between 5 and 7 inches, right, for penis size. But here, could we see any sort of pattern of any kind related to penis size here? You see anything that you would describe as a pattern? Or do you think it's just really big? Anything, think of topographical, maybe think of altitude, elevation in certain areas, or anything of the sort.
Closer to the equator and lower, seem to have bigger, average organ.
Alright, so closer to the equator, or south of it, you're saying,
I can't even say that, 'cause Australia.
yeah, I mean, because, right? You think of, this is a pretty big area. Alright, so basically it's spread out. On average, though, it does appear that maybe the larger members, and there's been studies where they've actually taken penis size of hundreds of thousands of men. And if you're thinking penis size, are you talking flaccid or erect? Right? So we say this is hard to determine. If you say penis size, what do you mean by penis size? Some men are growers, some men are showers, right? Some men may have larger penises, flaccid, but it doesn't expand an extra 3 inches, right? It may expand an inch. And some men may have smaller flaccid penises, but it gets engorged to very large size, right? So there's the myth in penis size, so don't let it fool you. So it really depends subjective. If we're talking flaccid, if we're talking erect, here they may be talking about, I think they recorded it when they were like flaccid. I think the Sudanese usually what it is. From whatever study that encompasses like the most participants. Alright, so that's the myth of penis